Your cholesterol report may be warning you years before heart attack ever happens. Two people can have high cholesterol, but one is at risk because of LDL and other because of triglyceride. Those are not the same danger. If your LDL is high, your arteries may be silently collecting plaque. If your triglycerides are high, your liver and metabolism may already be under attack. You may be cutting oil or butter, but if your triglycerides stay high, the real culprit may be sugar, white rice, alcohol, and insulin resistance. A cholesterol problem is not just a lab problem. It may be first visible sign that your blood vessels, liver, pancreas, and future health are at risk. Hello, everybody. I'm Dr. PK. Today, I want to talk to your heart to heart about a lab report that many patients ignore until something serious happens. A lot of people come to me and say, Doctor, my cholesterol is little high, my triglycerides are up, but I feel fine. Should I just stop eating oily food? Should I stop taking a medicine? And this is exactly where the problem starts. Because many people think cholesterol and triglycerides are just numbers. They think if there is no chest pain, no shortness of breath, no stroke, no diabetes problem, then everything must be okay. But that is not how these problems work. High LDL cholesterol and high triglyceride are often silent for years. No pain, no warning, no obvious symptoms, but inside the body, damage may be already building. Today, I want to explain this in a simple but deeper way. First, we will talk about high LDL cholesterol, then we'll talk about high triglyceride. And by the end, you'll understand what each one means and why they're different and why dietary changes matters most for each. So high LDL cholesterol, the silent artery problem. Let's start with LDL. LDL often is called bad cholesterol, but I want you to understand why. LDL is not bad because of the word cholesterol alone. LDL becomes dangerous because it carries cholesterol into the walls of arteries. Over time, those cholesterol particles can get trapped under the lining of blood vessels, and then inflammation starts, body reacts, plaques begin to form, and the plaque can slowly narrow the artery that supply blood to your heart, brain, and legs. And this problem can go on for years without you feeling a thing. And this is what makes LDL so dangerous. It's quiet, it's slow, it's deceptive. You may feel normal while plaque is growing inside your arteries. Then one day, instead of slightly high cholesterol, the story becomes heart attack, stroke, stent, bypass surgery, carotid disease, poor circulation in the leg. This is why LDL deserves respect, not panic, but respect. Now, where does LDL come from? Your body makes cholesterol because cholesterol is needed for hormone, cell membrane, many body function. So cholesterol itself is not evil. Problem is when LDL particles stay too high in the blood and keep delivering cholesterol into arterial wall. And one major factor that raises LDL in many people is saturated fat. Foods like butter, ghee in excess, cheese, cream, fatty red meat, processed meat, fast food, deep fried food, some packaged bakery fats can raise LDL in many individuals, especially those who are genetically sensitive. Here's the physiology in simple language. Your liver has LDL receptors, and these receptors pull LDL out of the blood. When saturated fat intake is high, the liver may reduce the activity of these receptors. That means less LDL is removed from the bloodstream, and when less LDL is cleared, LDL levels rise. So the issue is not simply that fat floats in blood after a meal. The issue is that saturated fat can change how the liver handles LDL. Now, I want to be careful here. Not all fats are the same. Healthy unsaturated fats from olive oil, nuts, seeds, avocado, fatty fish, they do not behave the same way as excess saturated fat. And that is very important difference. Many people hear fat is bad and fear every fat. That is not accurate. The bigger LDL issue is usually too much of saturated fat, not healthy fats in general. So imagine your arteries like flexible, clean pipes. When you are younger, they are open, smooth, and resilient. But high LDL, year after year, can slowly turn those pipes into inflamed, narrowed pathways. You do not see it, you do not feel it, but your future is being shaped quietly. This is why I tell my patients do not wait for a symptom to start taking LDL seriously, because once the plaque is established, we are not talking about prevention anymore. We are talking about damage control. Not everyone with high LDL got there only because of diet. Some people have strong genetics. Some have family history of early heart disease. Some have elevated ApoB or familial hypercholesterolemia. Some are lean active and still have high LDL. So please understand that high LDL is not always your fault. So what should you do if LDL is high? First, reduce the food that might most likely cause it. Butter, excess ghee, high fat cheese, fatty cuts of red meat, processed meats, heavy cream, fast food. Second, replace them, do not just remove them, replace them with olive oil, nuts, beans, seeds, lentils, fish, high fiber food, vegetable, oats, flax seeds, and psyllium. Third, know your full picture. Do not look only at total cholesterol. Ask about LDL, HDL, triglyceride, ApoB, family history, diabetes status, blood pressure, waist size, smoking, inflammation risk. Because heart risk is not one number, it is a pattern. Okay, so in the next video, I'm going to talk about high triglyceride, the metabolic and liver warning sign. This is a series of video you're going to be watching about hyperlipidemia, high LDL, high triglyceride, the reason behind it, metabolism, what you can do, what you cannot do. So this is very important video. So watch it completely and ask any question. I'm here to help. This is all to educate my followers. Thank you for watching. Have a great Thursday.